All right, it's the top of the hour by my clock, so I like to be punctual and respect everyone's time. So we are going to kick things off and let folks continue to roll in. We had quite a few people register for today's event, and we're extremely excited to have you all here with us today. So welcome. It's our Q&A, author Q&A for the release of the new book, When Are We Going to Teach Health by Duncan Van Dusen. My name is Brooks Ballard, and I'm the Vice President of Communications and Technology at Catch Global Foundation, and I'll be the moderator today. It's launch day. We're here. We made it. At Catch, we've been counting down to this day for over a year, and I certainly know Duncan's been counting down to it for at least twice as long. As of today, the book can now be purchased via Amazon, and during this special launch week, the ebook is on sale for just 99 cents, and that goes through November 15th. For those of you who like to have a physical book in their hands, there is a paperback edition also available. I know there's plenty of you out there that like to have that physical paper in your hand. I hope you'll pick up a copy today, and once you read it, I'm sure you'll recommend it to friends and colleagues. You can find a link to order the book that we'll be discussing here today by going to teachhealth.org. You can see the link, the URL on the slide there as well. Now, a bit about Catch. For more than 30 years, Catch has been proven to launch kids and communities toward healthier lives. The mission of Catch Global Foundation, founded in 2014 by our esteemed author here with us today, is to improve children's health worldwide via Catch's evidence-based health programs. The foundation links underserved schools and communities to the resources necessary to create and sustain healthy change for future generations. A portion of the book proceeds will go to supporting Catch Global Foundation's mission. Today's webinar is being hosted by the Michael and Susan Dell Center for Healthy Living at the University of Texas Health Science Center at Houston, UT Health School of Public Health. The Center for Healthy Living was founded in 2006 with a vision of healthy children in a healthy world, and a mission to advance health and healthy living for children and families through cutting-edge research, innovative community-based programs, and dissemination of evidence-based practices. You can see all their great work in public health at msdcenter.org. Also joining us as a host for today's webinar is the American School Health Association, or ASHA, which you'll hear more about shortly from their executive director. Now, before I introduce our speakers, let me cover a couple of basic housekeeping items. As with all of our webinars, we want to encourage attendees, particularly today, to ask questions and take advantage of the live aspect of the webcast format. You can submit questions via the control panel on your screen at any time, but to keep things moving along, we're going to hold off on answering those until the Q&A portion at the end. If you have any technical issues or problems, you can type those into the question box as well, and we'll do our best to help you out. I'll go ahead and answer the most common question and tell you that today's webinar will be recorded and archived on the MSD Center and teachhealth.org websites. All registrants will receive a link to that resource via email, and it'll be shared across our many social media accounts and web platforms as well. Now, on to our speakers. We could go forward one slide. There we go. Our esteemed author today that I mentioned is Catch Global Foundation founder and CEO, Duncan Van Dusen. In addition to leading our organization's health programs on creating a culture of wellness and speaks regularly on health behavior theory, health education, and the youth vaping epidemic. He completed his undergraduate education at Princeton University and earned his MPH from the UT Health School of Public Health. He enjoys spending time outdoors with his family, empowering his own daughters to exercise, avoid tobacco, and eat their veggies. Dr. Jeannie Alter is the Executive Director of the American School Health Association. The mission of ASHA is to transform all schools into places where every student learns and thrives, certainly something that resonates within the book we're going to talk about today. For Dr. Alter, the health of students is a professional and personal passion. Sabina Garrett is the Child Nutrition Program Director from Altus Public Schools and a 26-year retired military hospital administrator. You'll learn a little today about Sabina's amazing work helping to mount a district-wide response to the COVID-19 pandemic, and you can read about it in detail in the book. Her advocacy for health, education, and wellness is truly an inspiration for students and the community. I'll be back to moderate the Q&A session at the end of the webinar, and now I'll hand things off to our first speaker, Dr. Jeannie Alter. Jeannie, got you there on camera. I'll hand it off to you.
Great, thank you so much, Brooks. I appreciate it. I just wanted to take a couple of minutes to, one, express my appreciation and excitement for today. I mean, I'm so glad to be included. This is a wonderful resource, and I think that it really speaks to the work that we all want to do and hope to do for our students. The American School Health Association is a multidisciplinary professional association. We have been around for almost 100 years. We're beginning to plan for our 100th anniversary, so we're really excited about that. At the core of what we do is the whole school, whole community, whole child model. Essentially, we understand that the health of our students is important to their learning, and that if we work together, we can do better. So we are really excited to be a part of today and hope that you will take an opportunity to check out ASHA. We recently held our 94th annual School Health Conference in a virtual format. So all of the wonderful content is available for watching on demand, and registration is open through the middle of December. So please take a moment to check us out. You can find us at ashaweb.org. And we're really excited about this new wonderful resource and all the hard work that's gone into it. So without further ado, I'm going to pass it on to Duncan to tell us more.
Super. Thank you, Jeannie. Thank you. And thank you, everybody who has helped make this day possible in so many different ways. Obviously, this is a big and exciting day for me. But more than that, I hope that it's an exciting day for health and the process of teaching health to kids in schools. You know, we always say health is a team sport, and let me tell you, writing a book about health is a team sport too. So many of you in the audience are to be thanked for your mentorship, for your advice, large and small, about the book. I'm really delighted. When we first started playing this event, you know, we thought, well, I'll just get up there. And I said, no way am I getting up there by myself. This is a team effort, and I'm delighted to have, you know, folks that I work with every day, like Brooks. I'm delighted to have, you know, thought leaders within our industry, if you will, within our cause, like Dr. Alter. And I'm delighted to have Sabina, who's, you know, on the ground doing the real work that we talk about. And I'm delighted that she's going to be able to share her story. So in a way, I guess you could say it's not fair that my name's the one on the book. I really recognize this as a team effort, particularly for the Catch team, but also for all of you out there that have been evangelizing these ideas, in many cases, far longer than I have. So I hope that the book helps all of us to do that and to spread the word. And, you know, I almost published this book in about January, when Brooke said we've been counting down for a year. It was because we almost came out in January, and thanks to a good friend of mine, he said, you know, I think that you can do more, especially with case studies. So take a little more time, go back and add some more stuff in. And little did he know, and little did I know, that what was about to happen in March, and the visual depiction of what has happened since then, and that sad tragedy of what's happened since then is there on the screen. I hope that if there is a silver lining to all of this sadness and tragedy, that it is more obvious than ever that health is not common sense. If health were common sense, we would have figured it out already, and clearly we haven't. So just like math and English and history, health is something that needs to be learned, and it needs to be practiced, and it needs to be taught. And so when we look at this type of situation in our world, I think it's a good time to ask the question, when are we going to teach health? If not now, when? And please go to the next slide, Kate. So again, this really is not about me. This is about an idea. It's an idea that I know many of you already believe in, and I think that it really is an idea whose time has come. As Victor Hugo said, stronger than invading armies is the power of an idea whose time has come. As you can see, I can manage to work French literature into just about any conversation. So what I think we can conclude from what we see with the vaping epidemic and the COVID epidemic and ongoing non-communicable disease problems of diabetes and obesity and cancer and so on is that health requires education. And now more than ever, education requires health. We've seen that if we aren't healthy, we literally can't even go to school, and the process of education is substantially impeded. Next slide, please. So one of the things, I'm obviously not going to synthesize the whole book here, but there's one point that I really want to make very clear, and it's a perfect segue from what Jeannie said in the introduction about the whole child model. And whole child is, I think, very much a common cause between the world of public health and the world of public education. More and more educators and public health professionals realize this is the goal, is to produce whole children. And if we produce whole children, that they will be healthy and they will be well educated. So in the book, when we talk about teaching health, and in all contexts, when we talk about teaching health, let's remember, this is not just about classroom health education. It's not just what is the curriculum. When we think about whole child, we're really talking not just about knowledge transfer, we're talking about shaping healthy attitudes, beliefs, and skills. Skills are particularly important because health is social behaviors. Exercise is, for many people, social behavior. Eating is definitely a social behavior. Modeling healthy behavior is one of the best things that we can do as educators. And when I say educators, I'm including both teachers and principals, people who work in school districts, people who work in public policy, and of course, parents. And you know, when you add all this up together, there's 50 million of us who are essentially full or part-time K-12 educators. Recently, perhaps we may have been closer to full-time than we originally intended. And then there's another 50 million K-12 kids. So that's 100 million people. A third of America is either a K-12 educator or a K-12 student. And parents can model healthy behaviors to kids. And frankly, kids can model healthy behaviors to parents. One of the things that I love about Catch is seeing the natural way in which kids adopt healthy behaviors and bring them home and talk to their parents about them. That's part of the whole child process. Having a healthy environment, having an environment of celebration. You can see the picture there of yours truly at a celebration at a school in New Orleans. You know, when we think about teaching health, a lot of times people think about, you know, sex ed class or you know, alcohol awareness day or whatever in high school. That is in many ways too late for a lot of what we want to teach. We need to start teaching health early. We need to teach it often, not just one day a year, one awareness day a year. And we need to teach it proactively, where we're teaching positive behaviors like exercising, eating right, enjoying one's health, rather than just negative behaviors about don't do this or don't do that. And then finally, another key part of whole child is youth empowerment, is helping kids to own the process of health. Rather than creating a sign with pictures of healthy foods and putting it on the wall, let's have kids create the sign. One of the most successful programs we ran was a youth vaping contest for kids to create posters and PSAs of the vaping epidemic. Those things are far more powerful than anything that I could say or anything that any of us can say. So if we as health educators and parents can set the table and let the kids do the thinking and do the talking, that's the best way to teach health of all. Next slide, please. So I wrote the book for 4 reasons. And the first reason, and some of them hopefully are obvious and some of them maybe not so obvious. The first reason is there's a great long-term benefit to health, which is health. You get to enjoy health for, you know, your whole life, and the length and quality of your life is determined often by your health. And there's a statistic that the World Health Organization uses called HALE, healthy life expectancy. And in 2016 in the US, our HALE was about 68.5 years. So what that means is essentially your actual lifespan may be a little bit longer, but if there are some years that aren't very healthy, they're discounted to the value of, you know, a full year of health. That puts us tied 42nd with Poland, which I don't think is anything to get super excited about, and especially because that makes us the lowest among the 30 most economically developed countries, the lowest in healthy life expectancy. Furthermore, during the 6 years preceding that, between 2010 and 2016, our HALE actually declined, along with only 3 other countries, Iraq, Libya, and Syria, each of which had deadly civil wars, and therefore, you know, the life expectancy was affected by a lot of very, very premature mortality. So this is not think everyone would agree that this is not where we want to be as a society. This should not be the end result of all of our wealth, all of our technology, and so on. And there's some very concrete things we can do to all live healthier, longer lives. So that's the first reason. And then go to the next slide, please. And the second reason is, and this is really particularly targeted, for those who are thinking as educators, is there's also a short-term benefit to health around learning. Obviously, schools aren't in the business of preventing people from getting cancer 50 years down the line, but they are in the business of what happens on the math test next week. And it's really amazing, and this is really how I got into this subject. This is a graph from a paper that I did in graduate school that compares the cardiovascular fitness of Texas school children to their performance on the state standardized test. And it's unmistakable, up and to the right. The more fit you are, you're reducing your microvascular inflammation, your brain is properly oxygenated, you have energy, you have mood control, you're sleeping well, all of those things add up to you're doing better on tests. And I think this paper, which incidentally, I should say, this was published in the Journal of School Health, which is the American School Health Association's journal. And so thank you, Jeannie, and your organization for giving me my academic start. And it's gotten a lot of views and a lot of attention because I think educators can really grasp onto, okay, this is what's in it for schools to make sure that health is happening. It is a very clear and direct correlation, and it happens quickly. So that's the short-term benefit of school health. Next slide, please. There's another reason which we may or may not, people may or may not think about a lot, and it really is a social benefit around equity. Unfortunately, what you can see from this declining red line is that as the financial insecurity of a school or community goes up, as measured by free and reduced lunch eligibility, the academic performance of the schools, as this is in Texas schools rated by the TEA, goes down. So the schools in lower income communities are doing less well. And that's a terrible trend line and a very unfair trend line for us to be on as a society. So how do we get out of that? How do we break that pattern? Well, I don't have all the answers, but I do know that there's a little green dot up there that represents Ortiz Elementary down in Brownsville, Texas. And they have 92.5% free and reduced lunch, very low income community. But they have a 4.0 rating on academic performance. And if you ask them how they're doing things differently and how they have those types of results, the answer is health and whole child. And they're one of the case studies that's in the book. I hope you enjoy it. And it's a wonderful privilege to be able to share their story, because they in the entire state of Texas and the thousands and thousands of schools that we have here, only about 0.5% have been able to do what they did. And they truly have a culture of health. They are bought in. The principal is involved, the staff's involved, the parents are involved. Kids come to school early for running club if they wish to, and they feel that that's been a huge, huge part of their academic success. And that's how they've essentially beaten the very unfair averages of health disparities. Next slide, please. And there's one more reason, which I think in some ways is the best reason of all, and this gets back to youth empowerment. Kids want health. They actually like it. They love it. They enjoy it. And I'll give you, a couple of examples that are illustrated by these pictures. One is we did a survey after our kids took our Catch My Breath vaping prevention program, and we said, well, do you think that should everyone get this? Is this a good program? Should other kids get it? And 82% of the kids said, yes, all middle and high schoolers should get this program. And of course, that's a nice, flattering, reflection on the program. But I think more importantly, to me, is a reflection that kids want health. And they get involved in it, they get engaged in it. They don't want, to be surrounded by myths and misperceptions and pressures that they can't deal with. And then the second thing is, as we say here at Catch, if it ain't fun, it don't get done. which is, of course, a uniquely Texan way of incorporating the word ain't into a sentence. But we can also, look at it the other way, which is if it is fun, it does get done. And I love this picture from a school in Jefferson Parish, which obviously depicts, a whole lot of kids having fun, just doing a fun run. And one of the things I love about it is that they're all wearing these kind of homemade Catch shirts. We don't have brand police here at Catch. We let people, in addition to youth empowerment, we do community empowerment. We let people run with, what they kind of want to do, how they want to implement Catch within reason, and create their own t-shirts and create their own logos. And we think that's great. Nothing brings me more pleasure than seeing that type of thing, and seeing the very natural way in which kids approach health and in the way they want health. And hopefully this book will help to enable educators to give kids this very important thing that I think kids know is something that they will be able to use for their whole lives. Next slide, please. So as I thought about writing this book, there's really three audiences, and having glanced at the pre-registration list, I'm very pleased to see that there are people from all three of these audiences here today. So the first audience, the nucleus, if you will, is health educators. These are people, whether it's a PE teacher in a school, health ed teacher in a school, a community health educator that works at a state or local health department, SNAP ed educator. There's many different kinds of them. They don't always work for schools, but they work in schools. This is the nucleus. This is the choir, if you will. Many of you have been working with us these ideas, like I said, longer than I have. I hope that the book might add a couple of new things, and we are the people who think about this type of stuff all day long. And it's on us to bring these ideas further out. The second ring, if you will, is general educators, so classroom teachers, principals, heads of curriculum at school districts, and so on. And these are people whose profession, of course, is education full-time, but their profession is not health full-time. So they're thinking about education more generally. How do we develop the right academic skills, and so on. And I hope that this book can help reach general educators in the sense of health as a tool to do your job. If you want someone to be good at science or history or math, it sure is helpful if they're healthy. And you may even be able to incorporate health concepts in what you do, particularly science teachers. I mean, a lot of these things we talk about, they're scientific principles. The heart is a muscle, energy balance, the use of micronutrients, the use of macronutrients. So hopefully general educators, can find value here and educating better. And then I think the final ring is the very, very large number of parents and just concerned citizens. Of course, that includes grandparents too, who by definition are parents. And they don't think about health all day long, and they don't think about education all day long. They have other jobs, they have other lives, but they realize that to have the kind of society we want, for the long term, to have healthy lives, to have the kind of society we want for the short term, where we're learning and we're productive, and to have the kind of social equity, that many of us hope to see in society, we need health. Health can help us with all of these things, and I really appreciate folks who have other things to do with their career, but are taking the time to say, what, we need to make room for this. And many of you have advocated and continue to advocate for teaching health in schools. And I hope this book, if it does anything, can help you with that. And there is indeed a great case study in there about Parents in Action down in Florida and what they did. Next slide, please. Okay, so that's the end of my piece. Thank you all for being here, and we'll take questions in a sec, but now let me introduce somebody who I really admire, who is a great part of the army of people who's really doing the work, the on-the-ground work of teaching health, Sabina Garrett from Altus Public Schools.
Hi, Duncan. Thank you very much. Our district really is honored to be a part of the case study in your book. We have worked hard for a long time to try and incorporate health and wellness both with our students and our staff in our district. Our district is a rural community. We have about 3,300 students across 7 school sites. And because we are so firmly well-grounded in health and wellness, both for our students and our staff, earlier this year when the difficult times arose in times of uncertainty, we pulled our leadership team together and we brainstormed to come up with a viable solution on how we could continue operations, both virtual education as well as meals to the children from within our district as well as those within the community. But our main thought was to maintain that personal and food safety as we did this. So what we came up with, the answer was mobile meals. And to me, this resembled a military operation in my mind because that's my background. It was a vast challenge because we had to look at both the internal process as well as the external process. And so hence we named it Operation Bulldog Thunder. And it truly was an amazing process. And just to see it all come together and click made feelings come forward that you wouldn't believe. What we did is we have processes in place right now where we were able to piggyback on those alternative delivery models, such as in our breakfast in the classroom. We were able to use existing resources, such as insulated carriers or cam chillers for food distribution. We tapped into our vendors who were very willing to be a part of our process. Our staff, even in a volunteer capacity, took care of helping us in the preparation, the push of the food, the delivery of the food, and most importantly, our community support. It couldn't have been done without them. We were able to feed our kids and get everything out to them in a timely manner. So this was a large operation. We had to look at the financial, be financially aware. And so it was important that we utilize the USDA program, the Summer Food Service Program, to do this. We also utilized our commodity dollars that were allotted. The commodity distribution unit in Oklahoma at the state level allowed us to use the fresh fruit and vegetable program monies to also continue feeding and pushing those fresh fruits and vegetables to the kids. That's very important to me and what we have done for many years and want to continue doing, because it does make an impact on the children's health over time. The commodity, we were also able to get community donations, significant donations from the community to have added food items in the bags, whether it be fruits, vegetables, or grains, whole grains. And we were able to also incorporate a TSET grant, Tobacco Settlement and Endowment Trust grant we'd received a few months prior to all of this. The monies received for that, with that money, our agriculture department at the high school and junior high, as well as our STEM program, were using that in a classroom scenarios. And they already had fresh lettuce growing in the grow towers. And so they shared that with us, and we incorporated that into our mobile meals and the bag meals we sent out, the breakfast and lunch. So the mobile meals program was truly a success in our eyes. And the result of it is it was healthy meals provided to the students. And we provided a breakfast and a lunch for 5 days a week to them. At the end of Operation Bulldog Thunder, we were a little concerned, how are we going to continue feeding the children through the summer months after the traditional end of school year? Well, we teamed up with the Meals to You program. This was sponsored by the USDA, and it was an initiative with the Baylor Collaborative on hunger and poverty. And so this allowed us to work with them to get students enrolled and the families that wanted to partake in this for food to be mailed to them every 2 weeks throughout the summer months from June to August. So that was really our intermedium that we were able to continue providing food to the community, to the kids in the time that the district was not traditionally open in the summer. Our district wellness used all of this. We built on health, physical, social, and emotional well-being of our students and community. We wanted to continue that support nonstop, and that's exactly what we did. So the way we look at health is we definitely incorporate it into our classroom. It's important for health, wellness, physical activity into academics. And we have partners from the community that come in. It may be a dentist, it may be the OSU Extension Office. And also we have teachers that discuss nutritional facts with our kids. Or they may, when we push fresh fruits and vegetables to the classroom, they may talk about the origin of those fruits and vegetables. So we continue that effort ongoing throughout the school year as well. The CATCH program has been really instrumental to our district. We utilize that at all of our elementary sites. We had an amazing, strong curriculum to incorporate. This is both in the classroom and in the physical education classrooms in the gym. They provided curriculum as well as equipment for us, and it truly was a mainstay for our academics in the district. We have amazing partnering that we continue to use for advancing our health and wellness programs. We have a strong district wellness committee that has representatives at each site. The internal staff are heavily involved in this. They model the behaviors. It's both the certified staff and the support staff. It's not just the teachers, it's many more. The CATCH program, when they brought it to our district, we linked up with the Oklahoma State Department of Health regional health educator. She was in our district at each of our elementary schools every month for a long period of time to help us continue using that curriculum in a good manner to educate our students. Certified Healthy Oklahoma is another strong resource that we use that fosters policy and practices, and we modeled our district wellness policy off of those standards. And finally, the OSU, Oklahoma State University Cooking for Kids program. We've been a part of that for about 3 years. We've utilized staff training for professional development, and they also send a chef to our district to where they work with the staff, they work with the children, we do taste testing, we improve menus, we implement recipes they have. So that is also a huge factor that has impacted our health and our children. We are truly challenged each and every day, and we hope that this story will challenge you to implement some strong health and wellness policies in your organization. And the basic results are values. We want these values long-lasting for both the child, the family, and our staff, our adults. And we truly stand as advocates for health and wellness in the community. So I appreciate the time to say a few words, and Duncan, I'll hand it off back to you.
And I think now we're coming to the Q&A portion. So actually, I will ask you to stay on, Sabina, and I'll bring back Dr. Alter here as well, because I believe our next slide, Kate, is the Q&A slide. So I've seen several questions starting to roll in, but I want a few to kick off here. But we'll try to get to as many as possible. Again, that's kind of a big part of the event here today. I will say I apologize in the true spirit of COVID. This is the exact moment that a leaf blower has started directly outside my window, and it sounds like it's in the room with me. So I will try to mute myself on and off. But I apologize. Tis the times. So Duncan, I'm going to start off with a question to you. Just to kind of kick off here, I know you have so much free time. I work with you. I see you're just loafing around all the time. You're just looking for stuff to keep you busy. So my first question, and one I've heard from a lot of people as they've heard you've launched this book, is really when did you decide to write a book, and importantly, how did you go about writing a book?
Yeah. Well, thanks for the question, and I'm sure there are authors in the audience out there who will know what I mean when I say it. It really is harder than you think when you start. But as we say, it's hard by the yard, but it's a cinch by the inch. I first thought of writing this book actually on a plane ride home from Lansing, Michigan in February of 2018. And the fact that I was in Lansing in February of 2018 should tell you that I'm willing to do just about anything for school health. We had a great meeting with the School Health Advisory Council up in Lansing. Great conversation. And it really just occurred to me someone needs to write some of this stuff down. To be honest, you know, my dad was at the very end of his life at that time, and I was kind of thinking about, you know, mortality and succession, and it seemed like, you know, this is an important way of hopefully doing something that carries on. You know, we talk a lot about sustainability of programs and nonprofits. We don't talk as much about succession. Well, we do at Catch, because we recognize that succession is sustainability. So, you know, I look at this as just a giant relay race. We're all kind of handing the torch one to another, and while we're in the seat, we got to try to figure out how to, you know, capture things that might be useful for the folks that come after us. As far as finding the time for it, you know, like I said, that was in February of 2018, so it wasn't exactly, you know, a sprint over the last 30 or so months. I tried to chip away at it on nights and weekends. I remember, you know, sitting by the lake on summer vacation and trying to research stuff. And COVID, in a way, at the end, COVID was kind of my friend, because we've been, you know, my normal proclivity for travel and socializing really was not possible to indulge anymore. So I did do a lot of work over the last, you know, 6 to 9 months in getting it polished off. But I will say, one of the goals of the book is I hope that people will find it to be mercifully short. It's about 35,000 words. As I went through the drafts, originally it looks like it was going to come in only around 15 or 20. Most books are, you know, between 50 and 100. So my goal with this one is keep it on the short side, and hopefully more people can get through it.
Yeah, I will say it's an easy read. It's you know, the kind of thing that once we're actually flying and traveling again, it's the kind of thing you can take on a plane and you can finish it. You know, as long as you're not doing like an Austin to Dallas hop. But it's very easy to get through, and the case studies, I think, really kind of you know, tie together the you know, kind of themes and messages around the theory. So you know, kind of to that end a little bit. I kind of want to open this up to Sabina and Dr. Alter as well. You know, what do you see as the priority health topics for schools to teach? And that's obviously a little bit subjective based on your opinion, but do either of you have an opinion on that, as what the priority health topics for schools to teach are?
Well, if I might jump in there, I think that you know, in the time of COVID, we've learned a lot about ourselves, and I think it's really highlighted the importance of mental health promotion, and the importance of having conversations around mental health. I know, you know, I'm a parent to a 3rd grader, which is why this is a personal passion of mine as well. Is that, you know, emotionally, and that way, when or if things, you know, get really bad, we're better able to ask for help. We're better able to, you know, there isn't that stigma around, well, sometimes we have a hard time and we have to ask for help in some form. So I think that right now a light has been shown on mental health. Of course, you know, physical activity and nutrition are, I think, always, I mean, come on, look at us adults, right? We've been talking about the quarantine 15 or 19 or whatever it happens to be for you. So physical activity, nutrition, including what we're taking into our bodies in terms of alcohol use right now, is really, you know, is always a struggle for all of us. So I think that those are kind of the big 3 for me right now that I think about, and that the Times have kind of brought up for us.
I'm thinking that for our school district, it's really back to basics about hand washing and, you know, social distancing and safety, sanitizing, drinking clean water, fresh water, not touching your face, you know. And we have counselors that actually work with the kids and talk to them and try and help incorporate those basic public health facts. And so even with adults, that's important. We sometimes forget that.
Yeah, those are such great points, and I do, Sabina, echo that. We do hear a lot about schools being concerned about health right now, and one of our team members kind of pointed out that a lot of the response right now has combined basically health with safety, and you kind of mentioned some of that there as well. That we are health focused a little bit more, but maybe it's on safety for a lot of those things. And Dr. Alter, you too, about the mental health. I can certainly attest to the COVID X pounds dilemma. I'm sitting here, my fridge is in sight. It's not great for any of us. But yeah, mental health, that's certainly something I think that was starting to come to the forefront with some SEL, and now certainly is getting extra attention, much needed attention. Duncan, anything you want to add there?
Well, I would echo what was said, and I would just add that these things are interconnected. There's one of the great benefits of exercise, for example, is stress relief. One of the great benefits of mental health is a stronger immune system, right? So physical health, mental health, and immune health are really wrapped up together. And I think understanding and appreciating the connections between those things, and I include in mental health, I include social and emotional learning. Those are it's really a package. And I think if we can approach those, looking at those behaviors as self-reinforcing, that's when they become the most powerful of all.
So true, so true. And speaking of kind of self-reinforcing and kind of connecting, what's going on in schools to health and everything else. I just saw a question come through from Marielle that says, how do you make health a priority over STEM? She says, can you marry both? And I think that's kind of the kind of central point here is how can we make health part of the DNA of a school, not this siloed effort? Can you talk a little bit about how the book looks at that, and again, jump in, our other panelists here too, if you have either personal experience of how that's been successful or why and how we need to do that.
Yeah, I think that's a great question, and I agree, particularly with STEM. There's barely enough time for that as it is. So the way I look at it, I'll answer the question in two parts. The first part is there is much that we can do for free. And when I say for free, I mean without spending a lot of money and without spending a lot of time. And I outlined some of those strategies. There is time on the schedule for physical education and physical activity. Are we using that time well? And how can we use that time better? There is time on the schedule for lunch. How can we use the lunchroom as a health and specifically nutrition education classroom? Science, I mentioned earlier, how can we use the hours that we have for science potentially to teach or reinforce example that an ingredient that's safe to eat is not safe to vape, because the digestive system and the pulmonary system are two totally different things. That sounds obvious, but apparently it's not obvious. So I think that without spending a lot of time, and I would encourage all schools, before you think about spending a whole lot of time and a whole lot of money, let's do some of these basics for free. Now, if we're going to really get very far with it, then we are going to need to make some investments and to make some priority decisions. And I do, in the last chapter, I talk a little bit about, looking at the day, how many hours are spent on, a day or a year on English language arts, how many are spent on math, how many are spent on history. And when you look at that, you find that if we took 10% away from ELA, we would more than double health. You find that history has 12 times more classroom hours than health. So I think the challenge for educators is twofold. One, how do we do more with what we've got, the time and money that we've got? And two is, are we willing and interested, is there enough value, and try to make the case that there is, to actually take some of the resources that we've got and allocate them towards health proactively. One of the points that I notice as a parent, and many parents may have noticed this, is you constantly get asked by your kids, when am I going to use this? And sometimes when it's late at night and your kid's doing homework and they say, when am I going to use this? There's really not a very good answer, because you know in your heart they're probably not going to use it. I've never heard a kid ask that about health. You know, we use health every day of our lives, and I think kids know that. And if you use kids' own test of when are we going to use this, I think you'll find that health deserves a pretty prominent place on the agenda.
So true, so true. So, Sabina, Dr. Alter, anything to add there? Again, we're kind of talking.
Yeah, I just wanted to, build upon that to say, and Sabina, you had great examples of how you all work together and were very creative in your thinking and in solutions. And I hope that we don't lose that coordination that we're seeing and that creativity that we're seeing in schools, because there are other issues that are currently a problem within our schools. There are other issues that are going to become a problem, right? We have this whack-a-mole problem. Vaping is a perfect example of that. We were getting a handle on tobacco use among youth, and then vaping came along and, oh, here we go, right? And I hope that we don't lose that initiative to work together and have creative solutions, and that these, school wellness councils or school health councils, whatever they might be called within your school, that those remain, and that we continue to kind of keep our eye toward children's health in general, as well as what is the thing that's kind of popping up right now.
Mm-hmm. That's correct. And I think mentioning the wellness committees, the district wellness committee is just so essential in our district. You have buy-in from the staff, from principals down to teacher, down to cook, and you're able to get out there and you're on the front line talking with those kids every day. And when the kids start talking the talk, that gives you a feeling that, okay, I've broken the silence, the core, and they understand what I'm saying, and that lets you in to teach them even more. So I think getting through and getting buy-in from the staff is so important, and those people on your district wellness committee are the ones to do it, because they're not going to listen to me from the district office. They're going to listen to their comrade that's with them in the ditches at the school level, and then they're going to work together and build that camaraderie between schools for a whole district.
And can I also mention that I think that this time has really pointed out some of the unsung heroes of our schools. I mean, the extent to which we have relied on custodians during this pandemic, bus drivers, paraprofessionals, the folks who are maybe out during recess, the folks who are overseeing the lunchroom, right? There are so many people that I think kind of go unnoticed, that I think now are really getting the recognition they deserve. I hope that we realize that now.
I'm so glad you mentioned that, Jeannie, and I totally agree. And I think those are actually wonderful, non-obvious candidates for the school wellness committees. So often the school wellness committee, there's a couple of kind of the usual suspects, but thinking about having someone from the staff, having someone who's a safety officer, certainly having people that are food service or nutrition services workers, and a lot of those in the audience, PE teachers, for example, may say, we always try to get food services involved, and it's really hard. And it is hard. That's one of the reasons, Sabina, I'm glad you're here, because you have figured out how to get the food services department so involved. But the more different people, again, coming back to my very first point, this is a team effort. And the more different kinds of people we can get involved, the better. And I do think that is a way of recognizing them and giving them, a voice and showing, well, your opinion matters and you're part of the school health culture. What do you see out there? How can we do better? So I think just the very fact and act of inviting folks from some of those groups to be on these school wellness teams helps provide the recognition that they deserve. So I encourage everybody to, think creatively, and please share your ideas with us. We are partly exist to, promote best practices, and we love hearing about new things that you've done. Share them with us. Give us a shout out on Twitter or Facebook. Email me, Brooks, whatever you do, and we love to hear about those new ideas and share them out.
So true, and kind of to that end, a lot of people have asked specifically about Catch, and just to kind of broadly answer them. As far as where do you find more information, where can we learn more about Catch? If you go to catch.org, you can actually find a lot of program information, including all the different best practices. There's several free tools and resources. A lot of the stuff ties in with what we've been talking about here today. Now,
and for parents, there's Catch Health at Home.
Yeah, there is, very true. So I was actually going to tie into a lot of people have asked about parents. Parents being a very important, determinant of, especially with young children, setting them up to make healthy choices. So you talked about reaching kids while they're young, Duncan, and that's something that we need to do. Can you kind of, go back a little bit to why that's important, and
Yeah.
specifically how that's done and how parents fit into that equation?
Yeah, great. So I think the first thing, obviously, is parents need to, check our own attitudes about health. If we are finding pleasure in, being outside, working out, eating healthy, growing food, preparing food. I'm not saying that we need to do all those things. I'm, for example, not a great gardener at all, but we're valuing it. We're valuing, and finding joy in those health-related activities. I think that's to a large degree where it begins, because the simple fact is we're not all great actors, and if we don't believe it, we're not going to live it, and we're not going to say it. So I think, recognizing that when you have a social occasion, that's not the time to binge on bad food. Even if it is a birthday party, there are lots of ways to, make birthday parties fun without only having, a large quantity of unhealthy food. So I think that, talking to kids about food, go slow, whoa, that's a great thing to do at home. It's so easy, and kids get it at such a young age. Like I said, my daughter, I'll never forget when she was, 3 or 4 years old, she said, "Daddy, I like whoa food," which, she's honest from the mouths of babes, right? So yes, you do like whoa food, and it's okay. There's no food, but let's try to have more slow than whoa, and let's try to have more go than slow, because this stuff's good too, and try this. And helping kids to develop those positive attitudes in the home, especially in terms of what you do and what you say. And so let's not call candy a treat, because if we're saying that candy's a treat, we're saying you like this, right? This is great, and you should, when you're good, you're going to get more of this. And that's not the right healthy attitude. I think that, and many parents do great with this, with all the other things that they have to do. As difficult as it is to be a parent, I find many parents do this, and participating is a lot too. And when my kids were little, sometimes we would actually go to the track, and like one of them would be riding a bike and the other one would be running. We had because miles for it, and I couldn't just take them to the track and drop them off. That would have been really callous. So as a parent, if your kid shows an interest in it, get involved, do it with them. And then the final thing I would say on this subject is, I've been mostly talking about kids when they're really young, kind of especially in the 0 to 5, 0 to 10 age. What I don't think a lot of parents realize is you can also influence your school. And I hear all the time principals and folks saying, when we hear about it from parents, that tends to be when we really do it. And we saw this a lot with the vaping crisis, because as it got going, a large number of parents of middle schoolers and high schoolers especially saying, this isn't right, because either I'm upset that my kid is doing it, or my kid isn't doing it, and they're losing friends and not getting invited to parties and getting a lot of pressure from the ones that are. Like, what is the school doing about this? And we saw many cases where there were kind of information nights that turned into parents saying, what are you doing and when are you going to do it? And a lot of schools did adopt vaping education programs, in part because of parental pressure. I'm not taking anything away from the schools. Many of them did it because they thought it was the right thing to do too. But parents had a role in getting schools to do that. And so I would definitely encourage you, especially in numbers. There's always strength in numbers. If you feel like, know what your school is doing about health. And if you don't like it, ask questions and band together, in a nice way to get involved and help, put that encouragement on the school to value health.
Great. Well, I've got a couple more questions here. We're coming down to the wire here, but one is from your good friend and a friend of Catch, certainly, Kate Bellin asks, like, you say a lot of, you have asked a lot of questions that start with, what is the one ... So she asks, what is the one thing you would like the reader to take away from this book?
Thank you, Kate, for asking a question. What I'd like for the reader to take away from the book is health is something which can help our kids and help our society. And we need to decide if we believe that. And if we do, we need to make it a priority. Nothing will happen. We can't just say, oh, there's not enough time. Oh, there's not enough money. There is always enough time to do the things that we value. So we need to make the decision to value health, and we need to find the time for it. And I would not accept from schools that they don't have the time to teach health, especially when it's obvious that it helps schools to do the things that they are trying to do. And the closing words in the Ortiz case study from Principal Garza said it all. If you're a principal and you're not valuing health, you're working against yourself.
And that is a good place, I think, to kind of that wraps it up pretty nicely. But before we sign off here, I want to do a couple quick things. First is we've got good colleagues for a lot of folks here in Texas, and I want to just mention for those of you interested in health policy, I've actually seen a lot of questions come in. If you are in Texas, there's an organization called Partnership for a Healthy Texas, and they are holding their annual legislator briefing. Literally immediately after this webinar. It's at noon Central, and I definitely recommend those who are interested in health policy, these kinds of topics, and want to know how state government gets involved. Even if you're not a Texan, it's very informative. These are things that would work in lots of states. I encourage you to go check that out. It's going to happen at noon. You can find the link and how to get involved. Partnershipforahealthytexas.org. It's a great group. Go check them out. I do want to certainly thank our wonderful, fabulous guests here today. This was awesome. I think what a great way to kind of kick off this book. What great guests and what great discussion we've been able to have. So thank you all very, very much for being here. For all of our attendees, thank you so much for coming. So many people signed on today. This is so awesome. We hope you'll pick up a copy of the book. Again, you can find that link at teachhealth.org. And as always, please stay safe and be well. Thank you again, everyone. Take care, and we'll see you soon.
Congratulations, Duncan.
Thank you. Stay healthy.
Take care, everyone. Thank you. Bye-bye.